Hey everyone, welcome back to Dental Practice Heroes, and I am doing the second part of my solo episode where I was just giving clinical tips. So I'm going to give you tips to make you faster clinically so that you can get through your procedures faster, and I'm going to give you 15 more random clinical tips. You are listening to the Dental Practice Heroes podcast, where we create dental practices that are ran and driven by the team, affording us the freedom to practice less, stress less, and make more money. Hi, I'm Paul Etchison, author of 2 books on dental practice management, dental coach, and owner of a $6 million group practice in the south suburbs of Chicago. I want to teach you how to create a team-driven practice and achieve early financial freedom so you can have more time to do whatever it is that you love. Let's get started. All right, let's get to the first one. Let's talk about back-to-back class 2s. You're doing an MO and DO. Now, I know if you go and you look at these sectional systems, they'll show you how you can load up the whole quad with sectional matrices and all those rings and stuff. I haven't found that to be that predictable. And I feel for what it gains me, for the times that it gives me an open contact, it's not worth doing. So typically, if I'm doing back-to-back class 2s, an MO and a DO, I will restore the first one with a Toffelmeyer band, the old school Toffelmeyer. I just bulk it up, shove it in there, and then I take my flame diamond and I cut it back to the size that I want, because if you don't do that, it's going to be leaning into the adjacent prep too much. So that's the way I like to do it. I feel like you can make a broad contact and it's always perfect. All right, next tip. Let's talk about if you're doing multiple quads. Now, if you're doing multiple quads, you have to remember that the lower is always going to be way more unpredictable as far as anesthetic goes. We don't always hit our blocks and they don't always work. So what I want you to think about is never get into a situation where you start prepping on the lower, and if the patient isn't numb, you'll have to re-up your block and you'll have nothing else to do. So if you're doing multiple quads, maybe the upper and the lower, prep all your teeth on the upper, then go and start prepping the teeth on the lower, because then if the patient's feeling it, you can up your block and you can go back onto the upper and start restoring those teeth. Don't ever finish everything on the top and then go to the bottom and then they're not numb and you have to give them a block and you have to wait and you have nothing else to do. Which brings me to my next one, is that if you're going to do multiple quads, you're doing the top and the bottom, anesthetize the top first and then go and give the block on the lower. Most of the time, by the time you're done with your block on the lower, the top teeth are pretty ready to go. It doesn't take very long for that anesthetic to set up, maybe a minute. So I like to do it that way so you can give your anesthetic and get started right away. Now, a lot of people say, how do I hit my blocks more predictably? And I'm going to tell you how I do it. And I don't care if you're going to poo-poo on it. I use Septicaine. I use Articaine. You can tell me studies said this and that. I just don't see it. I've been doing this 15 years. You're not going to convince me otherwise. I like to use it on blocks because it just frickin' works. And another thing you might not know about this is that Articaine will work on a lower infiltration predictably premolar to premolar. So you can do the second premolar with a lower, just an infiltration like you would do on the maxilla. You can also, a lot of times you can get away with doing that on a first molar. Second molar, not as predictable. But that's one of those things that if you miss your block, you can always just drop an infiltration in there. And there's a ton of times where if I'm just doing one tooth, I'm telling you, I've done this with endo, I've done it with extractions. You just have to do an infiltration. You'll get plenty of anesthesia. Another thing is, what do I do when my block misses, when I don't hit it? Well, I'll give the block the second time, but if it doesn't do that, I'm going to different injection techniques. So I'm going to give like a long buckle. I might do the infiltration. If it's not working, I'm moving to the Ligajet. I love doing the PDLs. I find that those work most of the time, and they're really quick too. They only take like 30 seconds to set up. I would say maybe when I was practicing full time, 3 times a year, I would do a Gao Gates, and they're not hard to do. They almost always work. And the downside is the patient's numb for a really long time. So it's not something you do routinely, but it's nice to have that in your back pocket should you need it. All right, let's talk about doing multiple quads and fillings, or just whatever you're doing. I guess it doesn't really matter. You want to always get your occlusion straight in the one quadrant before you move on to the next one. So if you're doing fillings in the upper left and fillings in the lower right, totally complete your fillings on the upper left, get them restored before you start filling on your lower right teeth. Because if you're going to try to adjust the bite where teeth are all over the mouth now, you're just setting yourself up for a lot of adjustments, and chances are you're not going to feel that confident about it. So fully restore one quad before you go to restore the next quad. Make sure your occlusion's good. That'll save you a lot of headaches. So let's talk about root canals. How can we be better and faster at root canals? Now, this is one of those procedures where there's a lot of steps. And if you just sit down with your assistant and you sit there and you say, let's go through the steps and let's figure out who's doing what when, it will make it a lot faster, especially for the obturation sequence. Just sit down and figure out the sequence. For me and my assistants, we always do it in a certain order. Like for an upper molar, it's always going to be MB1, MB2, distal buccal, palatal. We're always going to go in that order for every measurement, for every drying of the canal, every irrigation, for the obturations. It's always in that order. So we figure that out so that we don't need to ask. I don't need to say, okay, give me the mesial buccal one. Give me this, that. So go through. I think that's the fastest way to do endo there's just so many steps. There's so much loss and efficiency with our assistants. Just sitting down and going through those steps. Another thing with endo is if you're doing in-office milling, you can prep that crown, do all the decay removal, and then just put like a little endo sponge in your access and build up around it, prep the crown, and then you can scan it. So by the time that crown is ready to be cemented, you're done with the endo. I don't always do it that way, but I have done it that way. And it's really cool to the patient because they can be in and out molar, root canal, endo, and crown within a 2-hour appointment. So it's an awesome way to do it, and it's an awesome service to the patient. All right, let's talk about that flipper that you put in and there's no retention. What can you do for that? I like to go on the bicuspids, and I just like to hold that flipper in place. I etch it, I bond it, and I put a little bit of flowable where that flipper meets the lingual surface of an upper bicuspid. I'll do this on one side. Sometimes I do it on both sides. But then you can pop that flipper out and polish that little nub that you created. And now you just created yourself a little undercut so that thing will stay in. And if you want to get the equivalent of a dental MBA, sign up for the DPH Hero Collective and learn how to maximize your efficiency in every single element of your practice, as well as how to lead and manage a dental team. dentalpracticeheroes.com. Go check that out. All right, let's move on to extractions. How can we do extractions better? Typically, when I see people struggling with extractions, it's because they're not aggressive enough with the elevator and they're not aggressive enough with the handpiece. So I will tell you, molars, section every single one. I will still elevate it and try to forcep it out just a little, but man, I can't remember the last time I've gotten out an upper molar without sectioning it. I just can't remember the last time it's ever happened. I just don't think it's worth it. I think it's so much easier just to section it and just plow away that furcal bone. Same thing with on the lower. You don't need that furcal bone. As long as you preserve the buccal plate and the lingual plate, you're going to be okay. So don't be all conservative with that furcal bone. Get rid of it so you have space to elevate those roots into. And you also want to make sure that you fully section that tooth. Because the thing is, if you don't fully section that tooth and you start breaking off slivers of it and you still got furcal tooth there, man, those are the ones that take you forever. And you can't figure out what the hell's going on. And then you realize, oh, I didn't get aggressive enough on my section. I should have removed more bone. So that's how you do molars much quicker. Just get in there and be aggressive with the handpiece. All right, let's talk about primary teeth extractions. We don't do a lot of these, but they suck, right? Don't they suck when it's like a young kid and they've got these big gnarly roots on there because you're taking the tooth out way too early? I mean, those are hard to take out. The kids are screaming. Mom's often in the room and she's like, why you hurting my baby? You know, I got a tip from a pedodontist once, and this was awesome, is that if you take, your forcep, don't even elevate that thing. Grab it with the forcep, push it to the buccal, and just hold it there for like 30 seconds. I will tell you, 5 out of 6 times you do that, that tooth will just slide out to the buccal. And you'll be so surprised. You'll try it and you'll be like, what the heck am I doing? Why am I still holding it? Just hold it there. It will come out. If it doesn't come out when you do that, you usually have enough movement where you can figure it out and then it's over. No more screaming. The kid's done. All right, let's talk about doing back-to-back class 2s on primary teeth. Now, this might be unpopular, but I'm just going to tell you what I do. is that when I'm doing 2 class 2s, an MO and a DO, maybe it's I and J, I will prep both and I will put the little T-band, the small little gold bands. I will band one tooth and I will etch both of them. I will bond both of them and I will fill both of them. And now you're saying etch. Isn't that going to leave a big ledge on the one tooth? And isn't that going to leave an open contact? Yes, it's going to leave a nasty ledge. And it's going to leave an open contact. Here's what's going to happen. Your open contact, it's going to close. Now you're going to say, you lost arch length. Yeah, like what? Like 0.2 millimeters? Like the width of a T-band? Big deal. What about that big nasty ledge? Just trust me, guys. It's going to be fine. It's going to look ugly on an x-ray, but they're going to lose that tooth and they're going to be just fine. It's going to save you time, and the kids, it's going to make it a better experience for them because you're not doing so many. You don't have to do one and then do the other one. You don't have to wedge it. Just put the band on one, fill them both, call it a day. Trust me. All right, next one. Let's talk about when you're trying in a crown and it fits way too snug. Like it just kind of gets stuck on there and you can't get it off. Sometimes you have to pick up a 2x2 and grab it to pull that crown off. If you have that happen, it's either one of two things. It is the adjacent contacts and you pushed it down too hard, or usually it's that there's just not enough spacer there and it's getting latched onto something. So some people might go and they'll open up the intaglio of the crown so it fits a little bit more passively. I think it's a lot easier just to take a chamfer burr and just prep around your tooth really fast. I mean, you don't have to take down a lot. You just have to prep it a little bit. You don't touch your margin, but you make sure that you prep it. And it's usually pretty low, pretty gingival on that axial wall that it's getting bound on there. And then that crown should fit passively all the way down. Your margins are closed. Easy peasy lemon squeezy. All right, last one, number 15. This one might be unpopular too. I'm just being real. This is what I do. What do you do with deep crown margins where you're like, maybe this could benefit from crown lengthening? Well, I tell you what you do. When you're prepping your margin, you take that chamfer burr and you prep away some bone right through the tissue. It's going to bleed like hell. It'll be okay. You're going to make a little bit more, just get some bone there. You're going to put a little trough into the bone. This is going to make it a lot easier for you to scan. It's going to make it a lot easier for you to take an impression if you're still doing PVS impressions. Just go ahead and cut away that bone with your burr. Everything's going to be okay, man. Now, it's going to bleed like hell, so you got to take some Viscostat. I love Viscostat, and a lot of people with Viscostat don't realize that you really have to kind of grind it into the tissue. It needs pressure. You've got to get it inside those capillaries. But you can take that Viscostat, and it will stop bleeding. It'll be fine. You'll be able to take a solid impression, and now you'll have a nice little trough there so that you can see that margin perfectly, whether you're taking the impression or you're scanning. So those are almost all of the tips I could think about. I was thinking about this the past few days. I hope you found those helpful, and I hope that you found that you could get through procedures a little faster. And if you found any of these helpful, please let me know. I really would appreciate to hear that this helped you get through some procedures faster. I hope some of you guys are trying these out this week. Those were the ones that popped up in my head when I said, what are the biggest 15 tips that I haven't already shared? So everybody, have a great week, and we'll talk to you next time. Are you frustrated with lukewarm online marketing that just doesn't bring in enough new patients? Let me tell you about Relevance Online Marketing. They're who I use, and they're truly the experts in turning your online presence into a patient-generating machine. Let's hear from California dentist Dr. Matthew Listillo on his experience with Relevance.
Hey everyone, we used Relevance Online Marketing a year ago, and we see a lot of new patients now. It went up from 10 to 15 to over 50 to 60 new patients. They do a great job in terms of making sure the job is done properly and that you get new patients overall and good quality patients as well.
Visit relevanceonlinemarketing.com to set up your free demo and start seeing more patients today. Mention the Dental Practice Heroes podcast and get your first month free. relevanceonlinemarketing.com.